Welcome. If you're a medical or dental professional, you know how critical this topic is. We're going to break down everything you need to know about consent for minors. Getting this right isn't just good practice, it's absolutely essential for protecting your patients and yourself.
So let's tackle the big question right away. You've got a minor in your chair, a parent on the phone. Can the child just say yes? Well, it's a classic clinical dilemma, isn't it? The short answer is usually no. But the real answer? Well, that's way more nuanced, and it's something you absolutely need to understand.
To really navigate this whole area legally, you first have to get your head around two key ideas: consent and assent. They sound kind of similar, but believe me, in the eyes of the law and medical ethics, they are worlds apart.
First up, consent. Now, this is the big one. This is the legal foundation for everything you do. It's the formal, official authorization from an adult who has the legal authority to give it. Put it this way, without this, you simply cannot proceed. It's your legal shield.
And then we have assent. This is different. This isn't about legal permission. It's about good ethical practice. Assent is when the child willingly agrees to what's happening because you've taken the time to explain it in a way they can actually understand. It's all about respecting the child as a person. This chart lays it out perfectly. Think of it like this. Consent is your legal key. It's given by a parent and it's legally binding. Assent, on the other hand, is your ethical handshake with your young patient. It's not legally binding, but it shows respect for their growing autonomy. You absolutely need the key, but you should always, always offer the handshake. Okay, so that leads us to a really practical question you face every day. Who exactly has the legal authority to sign that consent form? You can't just assume the adult who brought the child in has the right to say yes. That's a huge risk. The list of people who can legally give consent is actually very specific. Knowing this list is your first line of defense. It could be either biological parent, a court-appointed legal guardian, or, in very specific situations like an emergency, someone with lawful custody, like a school official. Now, here's something that causes a lot of confusion in a busy clinic. For most routine things, we're talking vaccinations, dental fillings, regular checkups, you don't need both parents there. The consent of just one parent is legally all you need. But, and this is a big but, you have to verify the relationship. A step-parent, a grandparent, an uncle, no matter how well-intentioned, they cannot give valid legal consent unless they have a court document that says they are the legal guardian. Goodwill, you see, is not a legal basis for treatment. Look, knowing the rules is half the battle. Proving you followed them is the other half. And that's where your documentation becomes your absolute best friend, your legal safeguard. Let's walk through exactly what you need to be writing down. Following these 4 simple steps creates a rock-solid legal record. Number 1, verify who you're talking to and note it down. 2, get that signed consent for the specific treatment. 3, make a note that you explained it to the child and they were on board. And 4, briefly jot down any questions and answers. That's it. That's your complete picture. Honestly, this is the golden rule right here. When you document both, the parent's legal consent and the child's ethical assent, you're showing that you are thorough, you're respectful, and you are legally sound. It proves you've covered all your bases. All right, let's boil this all down. What's the one thing you can take away from this and use every single day in your busy practice? This right here, this sentence, is your ultimate guide. If you are ever unsure, even for a second, just follow these steps. It's a simple rule that guarantees you're always doing what's best for the child while staying safely within the law. This explainer was brought to you by your med lawyer. Our goal is to help you stay informed so you can stay protected. Thanks so much for joining us.